Hello. We are back for week 2 of Aiming High. Last week we talked a lot about stress. What causes our stress, how we deal with stress, how we work through stress, all that. This week we are going to talk about something else. We are going to talk about prescription medicines and over-the-counter medicines. So, what is a prescription drug? A drug that is given by a doctor, right? Prescription drugs are prescribed by doctors and have legitimate uses in medical treatment. However, these drugs are too powerful or dangerous to be administered and dosed by individuals. The doctor will determine the safe strengths and dosages to prescribe to the patient that comes in to cure the illness without harming that patient. When writing a prescription, the doctor considers a number of factors regarding the safety of each patient. The doctor will factor in the health of the patient and any other medications that patient might be taking. The doctor also considers the prescribed benefits of the drug and weigh them against the side effects of the drug. Who could tell me what a side effect is? Did you get it? An unwanted secondary effect of a drug. Most every drug has significant side effects that could result in considerable discomfort, at best or at worst, death. In fact, thousands of people die every year from drug interaction complications and adverse reactions. Why then might people perceive these type of drugs as safer than street drugs? Well, because they're prescribed by a doctor, right? Over-the-counter or OTC medications are typically less powerful or a lower dosage version of prescription drugs. However, OTC drugs can still be dangerous if not used as directed. The little label written on the bottle or the box. Why might someone think these are safer than street drugs? Well, because they can be bought at a store and have science behind them. What may not be readily apparent to some people about both prescription and OTC drugs is that the consequences of misuse are similar to those of illegal drugs. Abusing these drugs can lead to serious illnesses, addiction, or possibly even dying. Anyone who uses or abuses prescription over-the-counter drugs can develop a tolerance to the substance. Who can tell me what tolerance means? So, did you guess getting used to the drug? Tolerance occurs when the body gets used to the drug. After a person uses a drug for so long, it will take more and more of that drug to produce the same effect, increasing the risk of possibly overdosing. Can anyone tell me what dependency is? Dependency is being addicted to a drug. Users can become dependent on a drug. When you depend on something, you need it. Dependency or addiction occurs when the body has become too used to having that drug that the user feels bad without it. So, who can tell me what withdrawal is? Withdrawal is when a person who is addicted to a drug stops using it and feels uncomfortable, irritable, or even sick. Any drug, including prescription and over-the-counter drugs, that cause physical or behavioral changes can be dangerous, and its use can cause tolerance or addiction. Giving it up can cause the user to experience a very uncomfortable and possible painful period in their life. So, where should we store our medications? This will be up to for your better look, but we have keeping pills in original containers, store your medicines in a cabinet with child latch or lock, away from direct sunlight, away from heat, away from moisture, in a dry place, out of the reach of children. This is so important. Also, talk to your parents about getting rid of old medication that was prescribed maybe 6 months ago. Because, in all honesty, if they didn't finish it, no one else in the house should be able to use it. If there's a medicine in your drawer that has your name on it, mom or dad or grandma and grandpa or any guardian should not be giving that same medicine to a brother or sister. So, I have 2 worksheets that are also going to be connected to the lesson. Go ahead and finish those. This is the end of our lesson. If you have any questions on how to store medicine or how to see if medicine is still okay, or how would you know how much to take, some of these questions can be answered in the worksheet, but if they don't, go ahead and leave a comment or message on your Google Classroom, and I'll be able to answer any of those questions for you. So again, this is it for this week. Next week we'll have a whole nother subject, and I can't wait to see you guys. Bye!